All right. Okay, I've enabled recording. Okay, so today we're going to talk, we're speaking with several clinicians today that will share the best practices for stress management, self-care, managing your household during the COVID-19 pandemic. We're in a pandemic still. I don't care what's opening up. We are still in a pandemic. So we want to be mindful of what the implications are and what measures we should be taking as older adults. We're also going to talk about the financial implications. If you are a caregiver, a lot is going on spiritually, mentally, physically. And so today we will be addressing that. And finally, we're going to talk about how to decrease your risk for dementia. So with that said, you're going to hear from Dr. Monica Parker, and then you're going to hear from Dr. Glenna Wren Gordon, followed by Alice Mullins, then Dr. Glenna Brewster, then Dr. Clint Dye after her, and then we're going to close with Darryl Blackwell, who is the manager of the DeKalb County Office of Aging. So again, we're going to cover a lot of information. Take notes. A PDF of the PowerPoints will follow, and the chat is open. If you have questions or queries, we will try to address those as we're moving along the session. So again, thank you, welcome. And with that, I'm going to turn it over to Dr. Monica Parker. Give me just a sec, Dr. Parker. You can introduce your content while I pull up your slides.
Okay. Good afternoon, and thank you so much for joining us on this webinar today. I want to say thank you to the Lou Walker Center and Mrs. Sharon Haley, who has helped us coordinate a presentation for you. We're with the Emory Alzheimer's Disease, Goizueta Alzheimer's Disease Research Center at Emory University. Yes, we do conduct research, but we also want to make you aware of opportunities for you to be healthy and how you may access, let's just say, the healthcare system along the way. So many of the providers here, with the exception of Dr. Glenda Wren and Dr. Clinton Dye, are clinicians who are affiliated with our university. In any event, one of the things that we've learned that's important to people, certainly people of color, is that a lot of times you might participate in research, but you don't really know how to do that. But before you can participate in research, all older adults need basic information about what we can do to help ourselves to stay healthy, what we need to do to properly access the healthcare system, and make sure that our primary needs for overall health and well-being are addressed before we can consider participating in clinical research. So we do these community educational events to kind of educate you, to kind of inform you, and help you understand that the Goizueta Alzheimer's Disease Research Center is not only doing research, but we're also trying to educate, to give back, to provide you information necessary for you to secure your own health and well-being, particularly as it relates to aging, but also as it relates to having a functional brain. Why? Because having a functional brain allows us to remain independent in our society and take care of ourselves without the benefit of having oversight or being, I'll say, put into a position where we have to be in custodial care anywhere, whether that's in our homes, in our family homes, or in a facility or a community somewhere else. Next slide, please. So let's talk about memory, okay? When we start thinking about Alzheimer's and related dementias, we only think in terms of memory loss. Well, the brain that occupies your cranium does more than keep you functional with respect to memory. Your brain helps you organize things. It helps you process information. It helps you organize the functions of your different limbs and extremities so that you can move from point A to point B. It allows you to modify your behavior in terms of how you conduct yourselves in social environments. It also allows you to learn new and different things. So when we think of Alzheimer's and related dementias, It's important to remember and take into consideration that dementia is a very broad topic, a very broad definition. But underneath this broad definition of dementia, we have different types of brain dysfunction. And because that's what I do, I wanted to tell you what it is. Brain dysfunction or dementia can be related to things other than Alzheimer's. The map before you shows you the prevalence of dementia, i.e. people who have brains that don't work well. The highest incidence of brain dysfunction is in the southeast and southwestern United States. That's the area that's highlighted by the dark blue areas. And that's from the coast of Georgia all the way to the western coast of Texas. Now, what is the significance of that? That coincides also with this being what we call the stroke belt. So there is a correlation or connection between the onset of strokes and heart disease, as well as brain dysfunction or dementia in the southeast and southwestern areas. We have a prevalent or a higher prevalence of this disorder in the southeast and the southwest. You'll note that in the west, in the northwest, and the central Midwest, you have fewer incidents of these disorders. So what could be causing that? We know that because we live in the, quote, the stroke belt, we have lifestyle changes that put us at risk for strokes, for heart disease, and other things that make it more likely that we're going to have problems with the way our brain functions. Other areas may be doing things, having a lifestyle that's consistent with making it possible for us not to have high blood pressure, not to have diabetes, and other things that may result in strokes. Next slide, please. In the state of Georgia, at least 50% of the Medicare beneficiaries who have Alzheimer's or related dementia have, more than one chronic disease. So what are some of these chronic diseases? Most Medicare recipients in the state of Georgia have 4 or more chronic diseases. What are these chronic diseases? High blood pressure, diabetes, high cholesterol, heart disease, chronic kidney disease, which results from poorly controlled hypertension and heart disease, anemia, rheumatoid arthritis, depression, COPD, and heart failure. One thing that I didn't put up there is obesity. Chronic obesity, overweight that begins in midlife, is one of the main etiologic factors or main causes for developing any of these diseases listed. Next, please. What are some of the risk factors for brain dysfunction? I didn't say dementia, I said brain dysfunction, keeping in mind what your brain helps you do. Being older, being blessed to live older, and being female, and your genetics, the things that you inherited from your parents, are things that are more likely to are putting you at risk or not at risk for developing dementia. Stroke, cardiovascular disease, and underneath that I have subheaded atrial fibrillation, heart failure, hypertension, and high cholesterol. Mood disorders that have been untreated, substance abuse, chronic alcoholism, which runs rampant in communities of color, tobacco addiction, i.e. cigarette smokers, vitamin deficiencies in B12, vitamin folate, and vitamin D deficiencies, people who may be treated for cancer with chemotherapy, people who may be taking benzodiazepines or nerve pills for anxiety, people who suffer from sleep disorders and haven't had those things addressed, uncontrolled or poorly managed diabetes, undiagnosed or poorly managed thyroid disease, chronic head trauma, and the deficiencies as I noted before. Again, these are risk factors for brain dysfunction or things that may contribute to the development, future development of dementia. Next. What are some of the things that can protect your brain? Education. Does this mean everybody needs to go to school and get a PhD? No, this means that everybody should strive to be increasingly literate, at least graduate from high school, so that you can interpret and understand information that promotes health and allows you to do better. Things like formal training in language, music, and other things are things that help protect your brain. The more you use your brain, much like muscles, like we weight lift to make better muscles, the more things we do to develop our brain and use our brain help protect our brain from developing brain disorders like dementia as we go along. Moderate aerobic activity or exercise, which helps control our blood pressure, helps control our weight, things that are risk factors for dementia. Anti-inflammatory drugs, because we know that certain kinds of systemic inflammation predisposes us to vascular disease that causes problems with blood-brain flow. Statins, because it protects against cholesterol and things that contribute to heart disease. Social engagement, what you're doing now, being on this webinar, going to a senior center, going to a church, affiliating with your sororities, your fraternities, anything that gets you out of your house and out from in front of a television set. Preventing hearing loss. You're like, what does hearing loss have to do with dementia? Well, hearing is the way that you interpret the world around you, as is vision. So getting an annual check for both your hearing and your vision are very important, because this is the way we interpret the world. This is how we interpret what's said to us and how we process that information. Managing and treating depression or mental health disorders are very important. Chronic diseases, poorly managed chronic diseases like high blood pressure, type 2 diabetes, and heart disease certainly make it less likely that our brain's going to work properly. Not getting enough sleep is going to affect how our brain works. And maintaining a healthy body weight. This has to do with obesity that we begin to develop in midlife. And it's sort of like, what do we eat? Apologies for the misspelling of Mediterranean. But consuming a Mediterranean diet or a heart-healthy diet, one diet that's high in low-fat proteins and not solid fats, is good for your brain. So what's good for your heart is good for your brain. Whatever they tell you to do for diabetes, for heart disease, is all going to be good for your brain. Next, please. Okay, we did talk about those different factors. I think that right now we're getting ready to move into the next speaker's presentation.
And Dr. Parker, as we transition and I pull up the next slides, there is a comment in the chat about, you mentioned diets, but one thing we didn't talk about, if someone is worried, we call them the worried well, what should they be looking for? What should they be concerned about? I mean, people say, I lost my keys. Does that mean I have memory impairment? So can you talk about that for a bit?
Those sorts of things are kind of normal, but they can be helped with a little bit of organization. And one of the questions somebody said, is it because diet is not healthy? Should I not have retired here? Well, a lot of your habits, your lifestyle habits, are things that you developed from the time you were born to the time you are where you are right now. I think that as we are given information to utilize to make things better for ourselves, we need to do that. So the more you learn, the more you read, the more you inculcate the things to make things better, that's what you should do. We're going to tell you about exercise. We're going to tell you about sleep. So the more you learn about how you can be better, that's what you do to be better. Momentary lapses are not problematic. What's problematic is if you forgot to pay your bills, if you forgot to turn off your stove and maybe you set the house on fire. These sorts of things are what we call sentinel incidents and indicate that you probably need a little bit more evaluation, maybe a little bit more supervision. Dr. Wren?
Thank you, and good afternoon, everybody. I'm really excited to be with you today, hopefully sharing some helpful information about how we can continue to maintain our mental health during this pandemic time. Go to the next slide. So I think the key thing that's an important truth is that we're really all at risk, and it's different from medical health conditions where you may or may not have diabetes, you may or may not have a cognitive disorder, but we all wake up and have mental health with some degree or the next every day, and we are all at some level of risk to various threats to our well-being on every day. And for a lot of people that are caring for older adults, they function as wounded healers. They themselves are at risk. So primary caregivers of dementia patients have a 50% risk of developing clinical depression. And it's true that if you have a loved one that has struggles with agitation or psychosis, that can cause a lot of distress on the part of the caregiver, and is usually one of the main reasons why institutionalization occurs, or why the individual says we can no longer safely manage our loved one at home. So when we're experiencing a pandemic stress, that happens really on top of that baseline stress that you're already facing. And if you have someone that's in a care facility, you may be experiencing additional anxiety and stress over not being able to visit, or concern about the practices that are being implemented in that facility, since it's a high risk environment. So even with no prior mental health history, we're all at risk because we have new stressors. People are experiencing job loss, financial instability, food insecurity, and the impact of social distancing. We're seeing tremendous impacts on children and adolescents. So you may be a caregiver and have children of your own that you've been managing to homeschool. Teens in particular have had a very difficult time. And there's indefinite uncertainty, and the thing that we're facing now, as we're in the third month into this, is uncertainty about safety. We are getting mixed messages, mixed signals about how to keep ourselves safe. We're having to come up with our own guidance on, is it safe to take a vacation? Is it safe to visit my parents, my grandparents? Is it safe in my environment? The governor may say it's safe. I may not think it's safe. My doctor may say it's not safe. And that conflicting information means it's that much harder for people to plan. You can go to the next slide. So some of those unique challenges, I mentioned the increased isolation. This has a direct impact on well-being because we are social creatures. We are created to connect. And when we have lost our typical forms of connection, whether that's through our faith community, through our social networks and community, that starts to really wear down our sense of well-being. And many people have difficulty accessing supports and services. So it's really great that we are here using technology, participating in a webinar. From a healthcare perspective, not everybody has the same level of access to telehealth services. So we've seen efforts to try to make telephone only interactions now be part of a standard of medical care, which is really good. But your regular community supports and getting access to food and traveling, we're all struggling with those additional challenges. In addition to feeling like I'm living under a constrained set of choices. And if you haven't been in jail or incarcerated or institutionalized, you may not have even had a reference point for what it feels like to feel like I don't have as many choices as I'm used to having. Even if you may have taken it for granted, we can go, oh, let's go check out a movie this weekend. Let's go to the park. Those are now all much bigger decisions now. I mentioned financial insecurity, and then the acute on chronic stress. So if you had stress before, now you have additional stress on top of that. And for many people, they're experiencing grief and loss, in loss of my way of life, loss because family members and loved ones have been infected or have died, loss of jobs, and you've lost your usual coping strategies. You can no longer go to church as you used to. I'm looking at the comment and seeing what is a common concern about how we're all managing our safety in terms of masks. And I've noticed that there's a wide geographic difference. I have family that's from the Northeast and friends that are out in California, and culturally, if you walk outside without a mask on, I mean, you're looked down upon as if an uncaring person. Whereas here in Georgia, maybe 20 to 30% of the people are wearing masks. Some Walmarts, for example, I live within 2 miles each direction of a Walmart. Here's an interesting observation. In the minority community, that Walmart is kind of like business as usual. Means they're kind of wiping down the carts. The staff has masks on and they're wiping down the self-checkout, but that's pretty much the only difference. The other Walmart in the other direction, in a primarily majority environment and higher socioeconomic status, they have labels on the floor that talk to you about where you should be standing 6 feet apart when you're standing in line. They've closed off one of the entrances and have people manning the flow of people in and out. And I thought that was really interesting how even our communities are responding really differently in terms of managing that risk. And that can be super, super stressful. So that's actually that last point about how we're managing the infection risk for ourselves and dealing with active infection. So next slide. So what can you do about it? Those are all the problems. So what can you do? The first recommendation I have is, and I'm a psychiatrist by training, I do telepsychiatry. I've done that before the pandemic, so I haven't really had too much of a change in my way of life from a work perspective. But what is different is that we all have to adjust our expectations. Things are not normal. So even though I worked from home before, it's not exactly the same because everything is different. Everything is living under the burden of this pandemic, and everyone's responding to it differently. And the fatigue and the emotional drain that comes from doing the same thing is greater because you're in adversity. So having the understanding that things are not normal can help you to adjust your own expectations. You may need more time to rest and recover than you're used to. We can all practice gratitude during this time to hunt for the good stuff and try to find the silver lining, whether that's connections with family within your household, connections that you've done virtually to maintain support for each other. That's a really healthy coping strategy. And then monitoring of your mood, checking in with yourself, to asking yourself every day, sometimes more than once a day, what do I need? What do I need right now? And identifying red flags. If you're feeling that you just don't care anymore, that you're not having any motivation at all, that it's really a struggle for you to get up and out of bed in the morning, that's a red flag that things have really gotten to the place where you might need some additional support. And the best piece of advice is really about limiting negative exposure to news, negative conversation, paranoid discourse that goes on social media. I took these steps very early in the pandemic and noticed a big difference once I started doing, you can 30-day block people on your Facebook feed. You don't have to unfriend them, but you don't have to see every post that they put up there and every communication. And this goes on both extremes. I want to see kittens and pictures of your kids and things that give me a positive distraction from my life. And you need to control your environment. You don't need to have the news on 24/7. You can check it a couple times a day. And then in terms of your activity, making sure you're moving, you're sleeping, you're eating, and you're connecting. Those are your basic needs. Focus on what you control, what you can control, and above all, just be kind to yourself. Be generous with self-compassion. I'm a mother of 3 children. I sometimes will lose my ability to manage all of their distress, and I kind of have my moments, and then just say, okay, I'm not a bad mom because I raise my voice. I can circle back around and process that, and be compassionate with how much work you're actually able to do and how productive you can be. And if you're concerned at all, seek professional help. I think the next slide for me is some resources. Yeah, so just wanted to share a couple resources that you'll get when you get the slides, a link to some specific guidance about psychological wellness in older adults, and some additional stress and coping resources, as well as the 1-800 number to the Georgia Crisis and Access Line, which is a great resource if you're trying to get behavioral health services and you're having a hard time doing it. This is staffed by licensed providers that can help you navigate your insurance so that you can get connected and they can get you access.
Okay, wonderful. I heard adjust your expectations and limit negative exposure. I see many comments here in the chat. I know you addressed one of them. If you and Dr. Parker want to tag team for the next 2 minutes, let's see here.
Yeah, I'm kind of scrolling them.
When did
Dr.
you
Parker.
speak with your PCP?
Okay, one of the questions, and many of you will forward to us on this webinar, some questions that I think are strictly clinical. If ever you have a specific concern about your health or a symptom or something that you see, we're strangers to you, but your primary care provider knows more about you. Kindly call that provider and schedule an appointment, whether it's telemedicine or a telephone conference, or maybe if they're doing visits, please ask these questions of your primary care doctor. We don't know your specifics, but your doctor does. Your doctor needs to be aware of what you're concerned about. And Dr. Wren, I'll defer to you.
Yeah, I think a lot of concerns too that people have about safety. That's another great option for them to reach out to their providers and get advice from that's a trusted source in terms of knowing my medical history and my risk factors. I know our family, everyone's different in terms of who's at risk and what you could and can't do. So I think it's better to get information from people that know you and know your circumstances rather than what you see passed along in Facebook, which really is very general and may not even be relevant to you.
Okay. All right. Well, they will continue to address any questions that are applicable to the content that we're discussing today. And now I'm going to pull up Alice Mullins. Hi, Alice.
Hi.
Okay. You all bear with me. If you want to share a little bit while I...
Sure. So what I'm going to be talking about is basically piggybacking off of Dr. Wren's presentation. And it's going to be more kind of getting into the practicals. And there's so many, but I said, let me do something that you can remember. So let's do an easy catch thing for self-care. And so the self-care strategies I wanted to discuss are S for support and social engagement, E to examine and express emotions, L is for laughter, F is for faith, C stands for compassion for self, A for activities. The R is I'm gonna talk about rest, routine, and I slid resilience in there, even though it's gonna encompass the whole thing. And then E for exercise. And you can go to the next slide. So one of the things, so starting with, I have, my mom is 83 years old and she lives in California by herself in her own home. She is managing, but of course that is kind of freaks me out because I'm also wanting to make sure she's okay. And so I kind of talk these things over with her, put things out to see what she's doing also, just so I'm not just speaking out of the air. These are things that my aunts and uncles who are in their 80s and 70s are also, we've talked about putting in place to help them through this time. And so for S, for that support, it's so important to stay connected as before. And talking about, it could be connected in terms of just video chatting with your friends. And some people say, well, I don't know how to video chat, or I haven't done it. It seems so hard to do. And what I suggest is I was able to help my mom from across the country. I just stayed on the phone with her and we worked through that. So if we can do the hard part in the beginning of getting connected, of setting that up, now she loves it. She's able to talk with her grandchildren, to see them. She's able to see other friends if she wants to. Now she's able to connect with her sister and brother-in-law who are in another city and that she hasn't been able to see physically. And so video chatting, virtual support groups. Some people are dealing with caregiving for loved ones with dementia. I encourage you to attend a support group. It is so important to connect with people who are experiencing some of the same things, to where you're able to bounce off ideas, to where you're able to understand that there are other people. You're not the person in it alone, that you're not by yourself. And also, if things are going to where you're really feeling something emotional, to where you're really having a hard time dealing with it, there are mental health helplines that you can actually just call into. But also talk with your provider about these things, your PCP. For E, when I say express, examine and express, sometimes we're not examining what we're feeling or we don't know. And this is one of those times, especially during this pandemic, some of us as Dr. Wren talked about, is experiencing grief. And we don't realize that, we don't recognize it, because we're thinking grief sometimes is just about loss of a person. But grief is surrounding other losses, our way of life, the way that we're thinking things should be. And so it's very important to examine what you're feeling and then express it, to get it out. It could be in terms of keeping a journal, writing down those things. And sometimes people have a hard time with journals because they're like, I don't want to put everything down. What you can do, simple way, is just do a 5-minute, just put everything out what you're thinking, and then just close the book and set it aside. And that gives you the sense of you did something with it at that time, at that moment. Also being grateful, writing down what you're grateful for every morning. It takes simply 5 minutes, 5 minutes just to list. It doesn't have to be long sentences, just 5 minutes of what you're grateful for. There is something to look forward to. Also conveying appreciation to other people, expressing that. It helps you, and it also helps that other person. So I would encourage conveying appreciation in terms of expressing yourself. Laughter, the L. Watch an old comedy, listen to a podcast, look at old pictures. You know that some of you will look back and see pictures of yourselves and think, what was I wearing? What was I thinking during that time? And you just laugh and engage. It's good for your soul. F, faith. And I'm going through these fast because I know we have a lot of other people, other content that I want you to get to today. F, faith. Faith, in terms of faith, can help you to have that hope again. It puts hope into life, into yourself, into other people. Use your faith, utilize that. Watch services online, listen to inspirational music, meditate, whatever it is, utilize what you have in terms of helping to boost your self-care and help you. It's been shown, it has been shown through studies to help with regard to your health. C, compassion, self-compassion, giving yourself permission to have feelings and to make mistakes, because we are our own worst critics a lot of times, and we always have this negative thing talking in our head. We've got to learn, have compassion. We can be compassionate so much towards other people sometimes, and yet we don't extend that same compassion to ourselves. Practice forgiveness of yourself, because you are not perfect, I am not perfect, nobody is perfect walking this earth. And so you need to understand that and be okay with that, accept that and understand, okay, today is a new day, tomorrow will be a new day, and you keep going. Activities, it's so important to be active during this time. And you know, people think, well, I can't go. You know, again, there's this opening of things and all of that. But there could be things you can still do in your home. There are virtual museum tours. Go online. If you've never been to Paris, they have the Louvre up on a virtual tour where you can go through. If you've never even been to the Georgia Aquarium, they have webcams that are happening right there, like with the penguins. You can see what the penguins are doing. Take those times, learn something new. As Dr. Parker mentioned, engaging your brain. That's what you want to do. So learn something new. If you haven't cooked before and you want to learn something like how to make one dish, don't make it big. It doesn't have to be, okay, well, you want to be this master chef, but just learn one simple dish. Learn to, somebody has learned how to knit now. They're learning how to knit. It doesn't have to be perfect. It just has to be learning how to engage your brain and do something different. There's so many things on YouTube where you can learn. It's amazing. So please, and you're never too old to learn. I have realized that, as I said, in talking with my mom, for her to learn how, she did not want to be on that laptop. She did not want to do Skype. I had to do Skype because that's the only thing at first she would do. Now she's on Duo, another platform on her cell phone. So if she's 83 and can do it, I know you can do it too. Or in terms of rest, routine, resilience, practice good sleep hygiene. It is so important to get sleep. It is not selfish. It is meant for you to be rejuvenated. That's what it's for. The National Sleep Hygiene, there's a National Sleep Foundation, which talks about good sleep hygiene in terms of the temperature of your room, in terms of turning off electronics beforehand, what not to drink before you go to bed. There are so many different things. So please, good sleep hygiene, get your rest. It is not selfish to get some rest, and you're not being lazy if you're getting rest. Now, of course, an appropriate amount of rest. I'm not saying sleep all day. I'm saying an appropriate amount of rest, which goes into routine, having some structure to your day. You should be structured. You should be getting up at a certain time, and you should be going to bed at a certain time. And you should be planning some activities during the day. It helps you in terms of mood, in terms of being able, your body clock. So routine is so important. But please be flexible. It is not where I'm saying, okay, be rigid with this. I want you to be able to understand just to do certain things. So you have things to look forward to, things that you've planned. Those are so important. And with that, with resilience, I want to put in there. Resilience, it is about the ability to adapt and overcome, to recover and adjust from misfortune or change, to grow and thrive in the face of challenges. You are resilient. I want you to remember the things that you've come through in the past. There are things that we have all been through, some challenges. It may not be the exact same thing, what's going on right now. However, you have gone through challenges. I want you to remember, reflect, and remember that you have overcome and can continue to overcome. And the last one, exercise, we've talked about it. Get outside. Don't have to go in front of everybody and walk with everybody at the park. Just go outside in terms of your yard, in terms of your street, and then walk. Put your mask on. But walk. You need to get outside. You need the fresh air. You need the sunshine. Get out there and do it. And then when you can't sit, do some virtual exercise classes inside. I sent my mom, I'm going to use her again, sent my mom some chair exercises via YouTube, and she actually did them. Woo! So happy about that. So you can do virtual exercise classes, yoga, chair exercises, all of those things. So please, take care of yourselves. You are valuable. You are worth it. Thank you.
Wow, thank you, Alice. That was amazing. It's a wonderful acronym. And again, I'm going to reiterate, we're at the halfway mark. We have about 120 people on. And as we transition to Dr. Glenna Brewster, I have two comments for you, Alice. I don't know what percentage of those 120 people are single or living independently, but over the course of the last several sessions that we've been hosting since March, what advice would you give to someone who, I mean, we're talking, you know, the phrasing switch from don't say social isolation or social to say physical distancing, but we are in isolation to some degree. So for single people, that's even more difficult. So what recommendation would you give to people who are single or living independently?
So I really suggest that you're making connections every day. It could be via phone. It could be via the, like a platform like this, like Zoom, but making connections every day. Talking with people and letting people know what they've shown in terms of, because this is traumatic, what we're living in, having that eye-to-eye contact and being able to express what you're feeling is important, because then you can also put positive things in to help it stick. We a lot of times hold on to the negative, but engaging and really being intentional. You have to be intentional with making the connections.
Wonderful. Thank you. That is sage advice. Okay, now, Dr. Brewster, will you go ahead and we have to talk about COVID-19. It affects older adults at an alarming rate, and that's why we're addressing it. So take it away, Dr. Brewster.
Sure. Thank you, Cornelia. So hello, everyone. Thank you for joining us. And before I get into it, I just want to talk. I know we've heard a lot about flattening the curve and the purpose of that. But if you can all look at the graph that I have there, it's actually called an epidemic curve. And what that does is that it shows the progression of illnesses in an outbreak over time. So what it shows is that it shows us the projected number of people who will actually contract the disease. And in this case, we're talking about COVID-19 over a specific period of time. And when we look at the curve, we can tell whether or not the outbreak is increasing or decreasing. And we can tell if the pathogen, which is the infectious agent, has a long or a short incubation period. And just incubation period just means the number of days between when you're infected with something and when you might start seeing symptoms. So we hear a lot with the COVID-19 about the 14-day period. And we usually start seeing symptoms within the first between 2 to 5 days. But we say 14 days because that's usually the length of time on average. There are people who fall out of that range on average, where we think that people would still have some symptoms and potentially might still be infectious. And in epidemiology, the idea of slowing a virus spread is so that fewer people will need to seek treatment at any given time. And that is what we call flattening the curve. And because of that, so if we look at the curve, we see that there's a steep curve, and that means that the virus is increasing significantly, and the number of cases will reach its peak within a few weeks. And guess what? When we have a lot of cases simultaneously, then we're going to have a lot of people who will be going to the healthcare facilities. And if we do have that, then we are going to have a system that will get overloaded and it will be unable to treat people. So what we really want is a flatter curve. So what it does is that it spreads the people getting infected over time. And because we have more time and people getting infected over a longer period of time, then the healthcare system will be less stressed. So we have the hospitals will have to turn away fewer people. They'll be able to take care of more people. And so thank you very much. So what we want to do really is to implement social distancing like we've been having, and stay-at-home orders and sheltering in place. And we have been seeing, especially in Georgia and throughout the US, the flattening of the curve, but it doesn't mean that the curve has continued, now that it's going down, that it can't rebound. With the reopening of the states, it's probably that we are going to see some type of a rebound because we now have more people going out and interacting with each other. And therefore, that curve might start going back up, or the line will start going back up. So what we want to do is to continue staying at home, or if we can't stay at home to the extent that is possible, then when you're going to go out, be cautious and stay safe. And some states still have some recommendations for populations of people over 65 or people with multiple chronic conditions. There's still some stay-at-home orders for those populations. Avoid touching your eyes, nose, and mouth. Washing your hands, continuing to social distance. So one of the things that I always say is to treat everyone you don't know or who you haven't been interacting with as potentially infectious until you know different. And if you're going to treat them as potentially infectious, it means that when you see them, you're not going to automatically run up to them and hug them like you did before. But you're going to say hi and continue to interact with them, but from a distance, or as Alice was talking about, calling them and speaking to them on FaceTime or Zoom. And then when you going out, or if you have to go out, to wear a mask when you're going into areas where there will be large groups of people. I see people wearing masks while driving. You don't necessarily have to wear a mask while driving, but if you're going to be interacting with a large group of people, then you should definitely wear a mask. And continue to routine clean, high-touch surface, and continue to practice good respiratory etiquette. So coughing into your elbow or into a tissue and then disposing it, sneezing into your elbow or a tissue, and washing or sanitizing your hand afterwards. Next slide. And with the current pandemic, there has been an increase in telemedicine visits. So as healthcare providers, we still want to keep touch with you and know what's going on. And for me, I work at a primary care clinic where we see persons living with dementia, and especially for caregivers, we do want to know what's going on with them, and we do want to know what's going on with the person who's living with dementia. So one of the things that we've done, and throughout healthcare, is that we've done a lot of telemedicine visits. And these visits are via Zoom or FaceTime or the telephone. And now a lot of people are familiar with Zoom. If you have an eye something, then you'll have FaceTime. And even with the reopening, we're going to have a ramping up of in-person visits. But I found that so many people have actually enjoyed the comfort of having a telemedicine visit that I see us probably going to more of a hybrid model where we can use both options. And private insurances and CMS are also reimbursing for these visits, so it'll be harder for us to not want to do the visits. So what you will need is you'll have your webcam and set it up at the eye level, and also have your microphone and your speaker and check that they're working. It's preferable though to have a headset with a headphone and a microphone. So before you have the visit, you test the application on your computer, test it for video and sound. Then you can set up a Zoom account. And we've heard about Skype and we've heard about Duo. And with Zoom, you practice by calling a family member or a friend. So for that, you'll ensure that you have connection, you can hear and see each other. And set a notification to remind you of the appointment. And where you will sit, find a place in your home where you will sit so that the provider can see you, or if it's in your home, or if you have your loved one who lives in a residential community, then contact them and tell them that you'll be having a visit with your provider. And then you want them to be ready to facilitate that call or that visit. And many of them are very willing and able to do that. On the day of the visit, you will close all unnecessary programs. You will plug in your device to have it continue charging during the visit. And as you prepare for any other visit that you'll have with your healthcare provider, you have your medication list to review. And based on your person's health status, some of us might have high blood pressure. Do we take our blood pressure on a daily basis? Then have those numbers to review with your provider. If you take glucose, you have those numbers also. And be ready to discuss how you're coping with a crisis or what you're thinking about now that we are going to go back to reopening and what you might want from them. Write down questions you will have to ask the provider. And then if you have any medication refills that you might want to request, then you also have those at hand. So you will have everything you want to speak with the provider there, even if it's telemedicine or you can't necessarily be in the same space, you'll still have the same experience with the visit. And the final slide. So now that we're going to see ramp up of clinic visits, there are some things that you'll have to expect when you're going in person. So you'll have to complete basically a longer symptom screening. And that will be where they'll ask you about symptoms of COVID. So they'll ask about a fever, shaking or chills, any loss of taste or smell, cough, shortness of breath, sore throat, body or muscle aches, headache, diarrhea, or rash. So those are the things that they'll ask you about. Then they'll do a temperature check. And when you show up, usually there'll be somebody at the door, and it's the no-touch thermometers that they're going to be using. So they'll check your temperature, and after that, they will provide you with a mask if you don't have a mask. But if you're wearing a mask, then that's even better for them. But if you don't have a mask, then they'll provide you for one. I know in a lot of the clinics that they allow you to be accompanied by one person. So for example, in our clinic, we have persons living with dementia, so the person will go with the caregiver. So you have one person who will accompany you. So those are some things that we think that might be important for you to think about as you're going to go back with integrating in the community and going to see your healthcare providers.
Wonderful. That was an amazing, short and brief overview of, what to expect, and just discussing flattening the curve. I think that is critical. To Glenna and our other healthcare professionals, there are two questions, and I don't want to get into too much detail, but what about mask? Can you clean it? Should you recycle it? What type of mask? Quickly. And then the second question is, what about privacy? Are these telemedicine visits being recorded, and what are the privacy issues?
So I can answer from the telemedicine. The visits aren't recorded, and they are all HIPAA compliant, so the visits aren't recorded.
Okay. And Dr. Parker, were you going to mention anything? Anyone wanted to address the mask?
For the
Everybody on this phone call who is 65 years of age and older should not venture into the public domain without wearing appropriate personal protective equipment. That means that you should be wearing a face mask when you walk out of your house and in public. You don't necessarily need to wear a face mask, as Dr. Brewster said, while you're driving in the car. But when you exit the car and you go into the grocery store, the library, or wherever it is you happen to be going, you need to be protected. You need to wear your mask simply because the mask protects you from spreading the virus if you have it and you don't know that you have it. But it also adds a level of protection. Certainly, if you're coming in contact with a lot of hard surfaces that may have the coronavirus intact, it's certainly helpful to wear gloves when you touch these things, like when you go to the grocery store. Dr. Brewster, do you have anything else that you want to add to that?
I was gonna add something about the reusable masks. So not everyone has access to medical equipment, but you can. There's several guidance about other fabrics that you can use. For example, you could use an old t-shirt and use 2 layers, and there are no sew patterns that are available for free that you could cut out and use that. If you have fabric glue, you can glue the 2 layers together or just keep them separate, and that's something that you can wash and reuse. Same thing if you're using a scarf or a handkerchief. You know, keeping in mind that when you're wearing a mask in this context, it's really more to protect the situation that you may be an asymptomatic carrier and you're protecting other people around you. It's not keeping you from getting sick. So everyone just needs to kind of have the right understanding of why you still have to keep distance, because it's more like the I care about you, why I'm wearing this mask. So that's the other thing I might add.
Thank you. That's important.
Okay, Dr. Dodd, because we want to be mindful of your time, and it is 1:54. And if we have time before we end, we want to address any questions. So, Dr. Clinton Dodd, please unmute. All right.
All right.
Okay.
Well, hello. It won't take me long. We're gonna get right through this. I've thoroughly enjoyed all the speakers before me, and I want to wish all of my friends out in DeKalb County, particularly at the Lou Walker Center, Happy Older Americans Month. As one of my grandkids said, Happy Older Grandpa Clint Month. I won't name who said it, but he knows he's not on the Christmas list this year. Not for that comment. Let me very quickly say that I want to pick up on what Dr. Wren said about the financial insecurity, and I'm sure that all of us now are feeling some of that, but it's certainly something that the caregiver is feeling even more. The financial strain financially in terms of functioning the role of caregiver is certainly something that we all have to think about. It's something that is not going to go away overnight. Even with the fact that we are opening up a lot more than we have in the past, we still have the concerns, the health concerns, and even more now the financial concerns for how we get through this pandemic. So we want to talk about some of the things that we can do as caregivers to kind of alleviate some of the situations. It's certainly not going to solve it, but may assist us in taking away some of the strain. I mentioned the last time we talked about looking at our existing financial challenges. One is credit cards. We all, in most cases, will have some balance on those cards. The ideal thing to do now would be to, if we can, to delay doing a lot of charging if possible. And if we have those balances, to start trying to reduce those balances and not use those cards as much. But in the meantime, we should be very aggressive about calling our credit card companies and seeing the kind of things that they are allowing us to do now to deal with the financial hardships. I know Credit card companies like Capital One, JP Morgan Chase, and some of the others are beginning to cooperate more by delaying payments and doing different things to help the cardholder during this time. The other, of course, is with rent. We talked about that. The Department of Housing and Urban Development, for example, has halted all the eviction proceedings for tenants who live in properties that are owned by HUD. We should take that in mind as we plan for going forward. Fannie Mae and Freddie Mac have done the same thing for people who live in some of their multifamily property. And in some cases can even check with those individuals who have loans to have that those loans deferred for a particular time. The main thing is that you can't be evicted, and you need to be aware of that. We talked about the mortgages. Mortgages is of course one thing that all of us are dealing with in most cases. We either dealing with our own or dealing with somebody's mortgage who owns whatever, wherever we're living. So how we do with our mortgages is becoming a tremendous stress. Homeowners can request from the agencies that hold those loans, back those loans, particularly if they are backed by federal enterprises, to get, they're granting up to 180 days for you to exercise your forbearance on those mortgages. And if you need it, you can even do it for additional 180 days. Now, the thing that you have to remember, though, is that those the interest on those loans will continue, and but the penalties on them will be waived. Now, if you are not sure if your mortgage is actually backed by one of the federal agencies, you can go to the Fannie Mae website, and I've listed that, 800-2 Fannie, or you can look up the tool for Freddie Mac, and that will give you the information as whether or not that particular mortgage is actually backed by one of those federal agencies. Now, in a lot of instances, your landlord may not tell you that. So if you or they may not even be sure in terms of the number of people who may be invested in that property, but you can take the initiative of actually going on those websites, and in most cases, they will list whether or not that particular loan is backed by any federal dollars. Next slide. Then utilities. We've talked about the fact that we should be very aggressive in terms of calling our utility companies, because in many instances, they are also willing to work with the consumer in terms of addressing the bills that you have for your utilities. I know Georgia Natural Gas, AT&T, and Greystone Power are all forming relationships where you can work with them if you request that. And but the thing to do is to be aggressive about and proactive about actually calling them to work that out. Telecom companies, we've talked about that. Verizon, Comcast, all of them have agreed to either not disconnect or to renegotiate your contracts. That's the thing that you really should do personally, I think, is that this is a time that you can really begin to renegotiate those contracts to see if you can get a better rate. And if you can't get a better rate, then you need to be looking for another vendor. I think a lot of them are going to be a lot more receptive now because they want to keep the business. And now's the time for you to be aggressive in negotiating that. Next. I want to talk a little bit very quickly about financial planning for caregivers, because it's something that we generally do not talk about that much. And I think that long-term financial planning is very important for caregivers. One of the things that I know is that if any of you have attended our past trainings, Dr. Parker has been very much committed to talking about things like elder law and the things that we need, the legal documents that we need to have in place as we carry out our responsibilities for caregiving. I think the same thing applies here for financial planning. As a matter of fact, as far as I'm concerned, even that was a part of financial planning. But what we're talking about here now is that we need to begin to look long-term about what's going to be happening financially in this country. It's going to be a while before our economy gets back to where it is. And in the case of the caregiving in particular, the loved ones that we are caring for, we know have a disease or condition that's not going to be cured anytime soon, it looks like, unfortunately. We know that as the disease progresses, it's going to be more expensive, both financially and emotionally, to attend to our loved ones. And we need to be assertive about developing a plan now, a financial plan that accommodates that and takes that into consideration. There are available resources to us to help us with financial planning. One that I talk about in here, I wanted to talk about, the next slide, please, is an organization that does it on a pro bono basis. The Foundation for Financial Planning is an organization, a foundation that's based in Washington, D.C. It's made up of professional financial planners who have agreed or decided to devote their time to actually providing these pro bono services. They do it nationwide. It's more than financial literacy. It's actually sitting down and developing a financial plan for that individual. It's something that I think that we should take into consideration, just as we're talking about in other instances where we talk about elder law and things that deal with the legal documents and our planning for that. We need to take that same attitude about developing a financial plan. You don't have to be a billionaire or a millionaire to think about effective financial planning. A lady told me the other day, if you got $200, you need to plan how you're going to use it and what the issues are and the challenges are down the road for that. So I'm very much suggesting that that be a part of it. This foundation also has a nonprofit that provides that kind of assistance, and even in some cases, grants for funding local efforts to do that. It may be something programmatically that we want to think about as we move forward with serving the individuals that we're serving now to do the training and all. So with that, I think that that's the only thing that I really want to do. I do want to make one other point. We've heard a lot about the stimulus checks. We heard a lot about the unemployment benefits. I just want to reiterate again the difference in those two pots of money or those two experiences. The stimulus checks are not tax deductible. That is true. However, I want to remind you that the money that you receive from your unemployment insurance benefits, if you're drawing unemployment, that money is tax deductible. You will have to file that with your income tax, and you will have to do that in most cases with a 1099. We've included with this presentation the website at the Department of Labor, where you can get the form that you need and the information about how to do that. But in keeping with that whole idea of financial planning, if you're drawing that money, you need to plan for or expect to have that money be a tax liability next year. Okay?
All right.
Thank you.
Well, thank you, Dr. Dye. What I heard was be aggressive. Don't wait. Because if you wait, it will be too late. If you need to negotiate, I mean, things are opening up and people kind of have the sentiment that it's all over, but we're right in the middle of this. It could be another, 9 to 12 months before we see things turn a corner. People are being furloughed, terminated, unemployment benefits are delayed. So if you can negotiate now, what I heard you say is do it while you can.
Exactly, because right now I think you have a lot more leverage in being able to negotiate the kind of deals that you might be wanting and it might be more beneficial to you.
Okay. All right. So we have one more presentation. You all, thank you for hanging out with us. We will be sharing information from the DeKalb County Human Services Department, and our final speaker, Mr. Darryl Blackwell, is the manager of the Office of Aging Division. And so if you are viewing or listening in and you're not in DeKalb County or you don't think you can access this information, we just want to reiterate that you probably or more than likely have an Office of aging in your respective county. So we just want to implore you and remind you and help you with navigating those respective resources. So are you unmuted?
Yes, can you hear me?
Yes, I have a
Okay.
little bit of an echo. You might want to turn your sound down a little.
Okay. Turn that down. How's that?
A little bit better. I would turn it down just a little bit for the,
Okay, how's that right now?
that's good. Okay.
Okay. Well, first thing, good afternoon, everybody. Want to thank Emory for their work. Definitely want to thank Blue Walker Senior Center and Miss Haley for all the work they've been doing with seniors. And to this esteemed panel is giving some really, really great information to the public. And so, as she said, my name is Darryl Blackwell. I have the pleasure to manage the DeKalb County Office of Aging. And the slide that we're on now just gives kind of a background about the Office of Aging. We used to be called the Office of Senior Affairs. So you can just forward the next slide. So the services that we offer through the Office of Aging are information and referral and assistance, case management, in-home services, homemaker services, personal care and respite, congregate meals at 4 neighborhood senior centers, home delivered meals, non-emergency transportation. We have an adult day pilot program with a provider, and then we also do medical appointments and dialysis. So next slide, please. And so basically, we provide this to seniors in DeKalb County and their family members and caregivers, but we also get calls that we have a lot of long distance caregivers that actually call us as well to try to set up programming for their seniors that live in DeKalb County. And we're getting a lot of calls now for emergency meals. So for folks that live in DeKalb County, that they're seniors, they can call our senior link line at 770-322-2950. Next slide, please. And so we're committed to providing services to seniors. We want seniors to network. We have 4 neighborhood senior centers, which we'll name at the end of the presentation, but we just believe in communicating with the public with our collaboration and coordinating all of our services. And we definitely are ramping up during this whole situation with the pandemic. Next slide, please. And these are just some of the programs that we have at our centers. Nutrition, education, and counseling. We provide a meal to the seniors. Now we're doing that. Actually, those meals are being home delivered since we have the senior sheltering in place. We also do arts and crafts classes, group trips, wellness programs, special events, and socialization activities as well. And so we're trying to move a lot of that infrastructure virtually as we speak. And next slide, please. So these are our 4 neighborhood senior centers. We have the DeKalb Atlanta Senior Center on 25 Warren Street, Lithonia Senior Center, the South DeKalb Senior Center, and the North DeKalb Senior Center. The latter 2 centers are our 2 newest centers that were replacements. And we're planning to build a replacement for the Lithonia Senior Center next year. And probably in 2022, we will have another senior center actually in Stone Mountain. Next slide, please. And that was it. It's a short presentation, but I wanted to thank you all. And if you have any questions, you can definitely call our senior link line, and we can definitely connect you up with the services that you may need during this pandemic and moving forward. So thank you very much.
Wonderful. One quick question. You mentioned, and I've heard this repeatedly about the emergency meals. Can you just share again, just so we can make sure people are aware of that resource? And then another common theme that we have heard over and over again is the long distance caregiving issue. How are you all addressing that as well, Mr. Blackwell?
Okay, so well, the first one with the emergency meals, there was actually a decree from our CEO, Michael Thurman, that if a senior during this pandemic needs a meal, that they could call in to our senior link line and we will connect them with a meal. We actually have a few providers we're using that can deliver the meal to them most of the time the same day or at the latest the next day. And we're giving out 5 packs of frozen meals to seniors in DeKalb County that need the meals. And then secondly, for the long distance caregiving, our INA staff has been trained to work with caregivers. And what we do is once the long distance caregiver gives us a call, we immediately take their information down, we connect with the senior, and we have a basic assessment that we do with them. And then we connect them up also with the Atlanta Regional Commission. But that's how, and then we connect back with the caregiver. So we have a pretty seamless process. And we've also seen an uptick in a lot of calls regarding long distance caregiving during this pandemic situation as well.
All right. Okay. So it's a little over time. We want to thank you. We appreciate everyone for joining us. The question in the chat has been, how can I access this recording afterwards? So we're on Zoom. Zoom behind the scenes is recording on our behalf. We then upload it and then convert it to YouTube and then send you out a link. So hopefully within the next 24 hours that will happen, along with a PDF of the PowerPoints. So in closing, I'm going to turn it over to Dr. Parker. She has some information she wants to share about an upcoming research study, and we will, if you want to stay on a little bit longer, we're going to address some of the additional comments in the chat if we can. Dr. Parker?
Sure. One of the things that Dr. Wren, Miss Alice Mullins, and Dr. Brewster also addressed was the need for all of us to remain socially engaged. So how do you remain socially engaged? Different individuals, different organizations are going to do it differently, but I would like to introduce a research study that we have called Conversation is Good for the Brain. It is we are the third of 3 sites starting in Oregon at the Oregon Health Sciences University and Michigan to engage older adults in a weekly conversation. Now, who is this for? This is really for those senior adults, persons 65 years of age and older, who live alone, don't have close by family members, and don't necessarily have a whole lot of interaction. So we call it iConnect. It's a project that began with the Oregon Health Sciences University out in Oregon. It extended to the University of Michigan, and now it's here in Atlanta at the Emory Goizueta Alzheimer's Disease Research Center. The project is called iConnect. If you are a senior interested in having greater socialization and engagement opportunities, please call Ms. Crystal Davis, who is our coordinator, 404-727-6696, if you are interested in participating in Conversation is Good for Your Brain, the iConnect study. Thank you.
Okay, well, without further ado, we will see you next time, and please join us next Tuesday after Memorial Day at 2 p.m. Eastern Time for Emory Brain Talk Live. Thank you and have a great rest of the day.
Thank you.